Welcome to Unmasked, the CCI Anesthesia podcast, the show where we dive deep into the world of anesthesia practice improvement, quality enhancement, and the evolving landscape of healthcare. I'm Kieran Zumwalt, your guide on this journey, as we explore the strategies, innovations, and stories that shape the future of anesthesia care. Clinical autonomy in anesthesia allows anesthesiologists and CRNAs the freedom to make critical decisions tailored to each patient's unique needs. By having the authority to assess and adjust anesthesia plans in real time, providers can deliver more personalized care, leading to improved patient outcomes and enhanced safety. This ability to act quickly in dynamic situations is key to optimizing care, ensuring that patients receive the best possible treatment. Beyond patient care, clinical autonomy also fosters professional growth and job satisfaction. Whether you're a seasoned anesthesiologist, a CRNA, or simply curious about what makes CCI Anesthesia stand out, this episode is packed with insights and inspiration. With us today, Alex Gorecki is the president of CCI Anesthesia. He has over 25 years of senior-level practice management and consulting experience, focusing on improving operational and financial performance at nearly 400 healthcare facilities nationwide. Alex, welcome to Unmasked.
Thank you, Kieran. I'm glad to be here.
We're also excited to welcome Bronson Taylor, CRNA, a seasoned healthcare leader known for his strategic vision and clinical expertise. Bronson holds a BSN from Utah Valley University and an MSN from Midwestern University, launching his career in autonomous CRNA practice in rural Indiana. He currently serves as the Chief Clinical Officer at Jeb's Anesthesia Management, overseeing operations across multiple states, and as Vice President of Clinical Affairs for CCI Anesthesia. With experience on the Board of Directors for the Indiana Association of Nurse Anesthetists, Bronson is dedicated to advancing rural healthcare and improving anesthesia practice nationwide. Bronson, thank you for being here.
Thanks. I'm excited to be here.
Alex, why is clinical autonomy a core value at CCI Anesthesia, and how does it align with the company's mission and vision?
Well, one of our missions is to attract the best and brightest providers out there in the marketplace. And so if you are the best and you are the brightest, you don't want to be held down. You want to be able to blossom, to work at the top of your skill set and your training. And so for us, it's critical to give those folks autonomy. The last thing you want is someone telling you what to do all day, limiting your ability to work successfully within your practice. And so for us, it not only makes good business sense from a recruiting perspective, but also good business sense from an efficiency perspective. If you have strong providers in a practice, you can function very efficiently. Everyone can carry their weight. There's no one that's having to drag somebody else along, that kind of model. In our case, it really helps having that autonomy because even though it may be a supervised model, if an anesthesiologist supervising a CRNA, we don't need them hand-holding them all day. The CRNA should be strong and be able to perform functions throughout the day on their own. And maybe they need a little help here and there, or they need some pre-op work from the anesthesiologist to make sure things are running efficiently throughout the day. But for the most part, if you have a strong team, top performers are going to draw other top performers, and they're going to rise to the occasion and do a really good job as a group.
And Bronson, from a CRNA's perspective, how does having clinical autonomy impact your daily practice and patient care?
Having clinical autonomy is one of the most important things as a CRNA. And how it affects my daily practice is I'm able to focus specific to each patient and come up with an anesthetic plan that's going to work for that patient. As Alex said, I don't have somebody telling me what to do or how to do it. I can tailor it specific to them. And as well, it helps you grow as a provider. You look for opportunities of growth. You see things in journals and just talking to other CRNAs like, I really like that. I want to try that. And so having the ability to do that just expands everything that you can do.
What are some specific examples of how clinical autonomy has led to improved patient outcomes at CCI Anesthesia?
From my perspective, is CCI really started more in rural areas, and being able to bring in a strong team that has that clinical autonomy specific to CRNAs allows that access of care to those areas, to those small towns. If you don't have that, it's hard for a hospital to be sustainable and bring in an anesthesiologist and a whole bunch of CRNAs and not have that anesthesiologist be part of actually in the room doing cases. So I see that from CCI's perspective is increasing access to care and also increasing patient care.
I would say too, you look at labor and delivery specifically, if there's a constant struggle if you're short or you're tight on staff between the OR, and someone that's in labor that needs an epidural. And if you've got a lot of clinical autonomy and people can flex throughout the day, it allows you to get over there to OB quicker, because that's a constant complaint with a lady who's in labor, is it took way too long to get my epidural. No one came in here to help me out. I've not been in labor, but I can imagine it's very, very painful. And when you want the drugs, you want the drugs right then. And so having that flexibility and that autonomy to be able to flex more efficiently is great for the patients as well.
And Bronson, how has the ability to make independent clinical decisions influenced your professional satisfaction and your career development?
I'm very satisfied from what I've been able to do as far as practice. I've been fortunate enough, I trained at Midwestern University. It was a very oriented towards, hey, you're gonna be the anesthesia expert in the room. You should know what you are doing. And so I have great job satisfaction working in the critical access hospital I do. I'm making decisions every day. And without that, it would be hard some days to go into work and feel like, as we say, we're just, some practices, CRNAs are just stool monkeys. They're just there in the room. You'll get a text message saying, hey, your blood pressure's low, give this drug. And you're like, what, where are you at? And you'll see that they're monitoring externally they're monitoring the patient. And you're like, oh, okay, well, that doesn't really sound fun. And so for me, it's a huge satisfaction. And I think for all CRNAs, it's a huge satisfaction to have clinical autonomy.
And Alex, how does clinical autonomy contribute to reducing burnout and increasing job satisfaction among your team members?
If you have two camps of people within the department, one's the top tier kind of providers, one or second tier, they can't do as much as the first tier, then that makes things very inefficient throughout the day. If you have everyone operating at the same level within the team, then you can share that workload more equally. And that minimizes burnout, because whether it's call burden, for example, if not everybody can take call, well then only a subset of that group is able to take call, and they're going to burn out, they're going to be miserable. But if everybody's sharing call equally, that makes it a lot more efficient, makes it such that it minimizes burnout, and then you can operate a whole lot more efficiently throughout the day. Two, if you have surgeons that have certain preferences, and sometimes they say, well, I don't want this person here, but I'll only take this person, or I don't want these 5 people. Someone will say, you got 6 CRNAs, I don't like 5 of them. Well, that's something we have to work to overcome and say, okay, what's the holdup here? What's the hesitation? Because we need everybody to be able to flex throughout all the different ORs and make sure that we can work cases throughout the day, especially when we're looking at add-ons and things throughout the day. Everyone has to be able to step up and do their part. And frankly, in the way we compensate people, everybody's getting paid the same. So they need to be doing the same level of work within that team. And so it's important for not only the patient care side, the surgical side, and then the operation side as well, that all those factors come into play to make sure people can work at the same level.
And it helps significantly with recruitment and retainment. When a provider feels like they're part of the team and you're all functioning at a high level, you don't have somebody feeling like, I'm pulling all the weight, I'm done, I'm checking out, I'm leaving. So we really expect all the providers to be at that same level, and we set those expectations with our providers.
That's a great point, and you got to hold them accountable too. If you've got one slacker, we all know the slacker. We've been in school, we've seen the guy that just cheats off everybody else's paper or whatever. If you have one slacker, everybody else is eventually going to say, why am I trying so hard? So that comes down to leadership within the department as well. If you have a strong chief that calls people out and says, listen, I need you to get on the team here and get up to speed on things. And if they're not, then that's when CCI works to replace that person. Why penalize all your high performers because you have one person that's dragging down the whole team?
How does CCI support its clinicians in maintaining autonomy while ensuring they have the resources and collaboration needed to succeed?
I would say from a clinician standpoint, being on the medical affairs, CCI, we're always trying to bring efficiency to anesthesia. So we're looking at different models. How can we be more efficient here? But also, not just from a model perspective, we're very selective in who we appoint as a chief. If that's a chief CRNA or a chief anesthesiologist, because they are kind of the boots on the ground. They're the ones that are going to help give those resources to the providers that may be struggling. From a medical affairs standpoint, we're always wanting to make sure our providers have everything they need. So if it's equipment, if it's something specific drug, a big drug that we talk a lot about is Sugamidex, and a lot of hospitals are very hesitant to want to pay for it. It's a more expensive drug, but to be able to help the hospital see the importance of it and give that resource and that support to the clinicians is something I see CCI do a lot.
Also from a quality and compliance perspective, so high performers, they want to be at the top of their game. They want to do everything exactly it's supposed to be done. And if you don't know that something has changed from a compliance perspective in terms of what the federal government or JACO or whoever, Joint Commission, if there's something new that they're looking for when they come in to survey people, you don't want to get dinged. You don't want to get a C when you're an A+ kind of person. And you're going to be frustrated if you get that C because you didn't know what you had to do to be an A+. And so that's on us, on CCI, on our medical affairs team, our compliance, our quality, all those folks to say, okay, here's the newest tools for your toolbox, just so you know what's going on. And then now they feel equipped and they're ready. They don't need you to spell it out for them. They don't need you to hold their hand through it. They just need to know this is what the expectation is now. And then from just a pure HR perspective, if there's issues with interpersonal issues with a provider, and maybe two providers, maybe the chief and the provider, or maybe it's with nursing or surgeon, they want to know that we're going to intervene and help that situation out so that it doesn't just fester and get worse and worse and worse. We want to be there, kind of to be their advocate, to make sure they're represented as well, especially if there's accusations coming in from somewhere, maybe they're not getting along with somebody, and someone's saying, oh, I think they're diverting drugs. Well, that's a huge accusation to make, and so that's on us to say, let's understand this situation. And so they need someone to advocate on their behalf sometimes too.
And I think too, some CRNAs, when they've been in a more restrictive practice and they come and work for CCI and they have that clinical autonomy, we can work with them and give them resources. Hey, this is how you approach surgeons when you have to have those difficult conversations. I think that's something some CRNAs are really uncomfortable with because they've never had to have that conversation, or they've never had to really think like, is this appropriate? Should we be doing this case? So as a medical affairs team, we're always giving them the tools so that they can make those decisions, but also have those crucial conversations with surgeons.
So Bronson, can you discuss how collaboration with surgical teams works in an environment that values clinical autonomy, and how does it enhance your role specifically?
Yeah, so if you have an environment of clinical autonomy, I always give the example of where I work. It's just a CRNA practice. And the surgeons recognize us as the anesthesia experts in the room. So because they know that we are making all these decisions and we have this autonomy, they're the ones that reach out to us. They will come to us and say, hey, I've got this patient. This is their medical history. What are your thoughts on doing that here? And so then we can have a really professional conversation and talk through everything, and they can see our perspective and our concerns. And in the future, there's going to be high tension, high stress moments in the OR. It's just nature of the OR. When you're able to have that strong relationship, they're going to recognize you're here, and they feel safe doing the surgery, but they also trust you that if you poke your head over the drape and say, hey, we got issues, they're going to turn and say, okay, what's going on? They're not going to blow you off.
And Alex, what kind of training or professional development opportunities does CCI offer to support its clinicians in exercising clinical autonomy?
Well, there's a broad array of things our medical affairs team does, starting with the leadership up top with the chiefs, a lot of through our CCI Leadership Institute. We have ongoing training and development. We have kind of an in-person meeting as well, where we do a lot of education, not just on clinical matters. A lot of it, we do blocks, clinics, and things like that, but we also do basic management 101 skills that maybe if you're a physician, you went to medical school, they didn't have a class on how to manage when someone comes to you and says, this person said something mean about me behind my back and I'm upset about it. Like, what do you do with that? Some guys are like, I don't want to mess with this. But as a leader, you have to deal with those kind of issues. And so we develop that for them. We do a lot of ongoing feedback to our providers as well on the quality management side to give them feedback on, okay, you had a fallout over here, here's what we recommend you ought to do with that. The chief will do a lot of that too. That comes from medical affairs. On the compliance side, we'll do mock audits. We'll go in, our chief compliance officer, he was a former Joint Commission surveyor and a CMS consultant. And so he'll go in and he'll find all sorts of things that are just out of base there and say, okay, you need to correct this and this, and give them that feedback so that when the real survey comes, they're ready for it. but giving them that ongoing feedback on how they're performing, how they're developing. We do monthly meetings with our staff, our clinical staff. The chief leads that. Our regional directors of operations are involved in those. Bronson's involved in those as well. And it kind of gives them feedback as to how the team is doing, how the hospital is doing, anything they questions. A lot of times we invite hospital administration down there for it. And then how CCI is doing as well, keeping them connected to us. And that way, there's a lot of Zoom calls that we do to get people together because people are in different locations. They're remote, and so it's nice to get them together. We did a lot of that during COVID. We had all of our chiefs together on giant Zoom calls, and they would say, this is what I'm doing for my PPE stuff. Here's how I'm rigging up this equipment, because they were short on resources. And so it allowed them to kind of feed off each other a little bit and get ideas as to how they can operate more efficiently and effectively within their teams.
Bronson, how does CCI's approach to autonomy help in your continuous learning and professional growth?
Obviously, when you are in charge of the anesthetic, you're always thinking, okay, what's plan A? This is plan A. Well, if plan A fails, what's plan B, plan C? You always have a backup plan as an anesthesia provider. And so you're always looking at different ways you can treat a patient for pain. That's a big thing right now, especially with the opioid epidemic. I'm very involved in the recruiting of providers, and so I like to really talk to them about how they're doing with regional anesthesia, offer some pointers and things like that. The great thing is that when they get into a practice, they're actually going to be doing those blocks. So they're going to be actually involved in that. There's some practices where they're not involved. And so when you have that autonomous practice, you know that, hey, I'm going to have to be able to do these blocks, which keeps your skills up, and it also requires you to really think like, how do I get myself out of a situation? That's one thing I always talk to SRNAs about is, okay, you got into this situation, how are you going to get yourself out? So you're always looking at what's the newest trend here, what's something I could do as a relief valve to get out of a certain situation.
So Alex, what qualities or attributes do you look for in anesthesiologists and CRNAs who are interested in joining CCI?
Definitely, it may sound corny, but that team player mentality. You have to operate as a team, you just do. People have good days and bad days, and the rest of the team has to compensate for that if someone's off on their game that day. I need people that want to work hard, that understand you're going to have long days, but then you're going to have days where you wrap up early. I don't want to hear the complaints because you worked till 5 o'clock today and you were supposed to be off at 3, but I know Friday you got out at 11 in the morning because they wrapped up early for the day. So having that balanced approach to understanding your workload and dealing with the peaks and valleys effectively is key. I want people too that want to be engaged with CCI. We do a lot of outreach to providers. We go to a lot of state association meetings, and we like to have our providers come to those meetings with us and work at the booth with us and hang out with us and kind of be that face of the organization. It can't just always be marketing that does it. They expect marketing to do all the marketing stuff, but the best representative of clinicians is clinicians, and it's great to have them at the booth. And so many of our folks have such great personalities. And they're really eager to help out and do whatever they need to do to help promote their local practice and promote CCI as a whole. And so it's great to have them as team members.
So Bronson, for clinicians considering a move, what advice would you give them about the benefits of joining a practice like CCI that prioritizes clinical autonomy?
So obviously, I think anytime somebody's looking to make a move, they're assessing, okay, the location, what kind of autonomy there is, and what the pay is. And so obviously CCI hits it home on the autonomy. The benefit of coming to work for CCI is you're going to be heard. We want to talk to you about things. I'm constantly getting phone calls and texts from CRNAs saying, hey, I have this concern, and they're heard. I think a lot of times when anesthesia providers work in a big box anesthesia group, they feel like they're just a peon. They're not heard. And so I've tried really hard to make sure that I'm available to all the CRNAs to talk to them. That's the first benefit. You're going to have great job satisfaction. If you go from a restricted practice to a practice where you're actually making all the decisions and all the calls, you're going to feel like you're part of the hospital. You're part of that patient care, and you have a vested interest in the hospital, and you want every patient that you interact with to have a good experience. And as well, you're going to have the opportunity to build relationships with surgeons that you might not have had that opportunity in another practice, and actually really sell yourself to the surgeons, especially in CCI, because there are some places where it is all CRNAs. And so there's a high expectation, and you need to be able to sell yourself to them and show them how well you are as an anesthesia provider.
I would say there's growth opportunities too. I mean, to grow, you can grow as a CRNA because, like Bronson said, sometimes you end up in a CRNA practice, all CRNA. And it's an education sometimes for the surgeons if they're used to having the anesthesiologists involved. But this allows you to grow professionally, to have a stronger relationship, stronger rapport with surgeons. And then even growth beyond that, you can become the chief. You can become, we have regional clinical officers who are CRNAs, we have regional medical officers who are physicians, and then they can move up through medical affairs and become, like Bronson, the vice president of clinical affairs. We have other people that are VP of medical affairs, EVP of medical affairs. We have a whole progression of growth opportunities within our medical affairs team. And so if you're someone who kind of has those aspirations to grow professionally and even venture more into the business side of managing practices, we have lots of opportunities for people to do that as well.
How does clinical autonomy impact efficiency in the OR?
So right now, there's a huge shortage of anesthesia providers. So we need every capable anesthesia provider in a room doing cases. And that's what CCI brings in, is obviously, we talked about this, efficiency. We look at how can we be more efficient when it comes to anesthesia practices. And there is a lot of change management that happens. There are a lot of places where we have come in that has traditionally been a physician anesthesiologist heavy practice, and we've changed those practices. And obviously having strong providers is essential for that, and having good on-site leadership to manage that message is essential in those changes.
How do we ensure that we are recruiting the best and the brightest into our current open positions?
So I always joke with people, it's the triangle. You have autonomy, pay, and location. And there's a CRNA that has kind of been a mentor to me. He said, at points in my life, there was a location where I was like, I can't live there, but now if there's a Walmart, I'm good. So and that's a lot of our sites. They are very rural. So that's something that CCI really focuses on is, we can't change location, but we can really focus on clinical autonomy, all CRNA practices. And we obviously want to pay providers well. When a CRNA has the ability to practice to their full scope and their full skill set, they should be compensated for that. And CCI does that. They compensate CRNAs for what they do.
Another thing, we make sure we give them adequate time off, because especially if you're in a smaller community, not that all of them are in small communities, but those that are, you're anesthesia for that community in some cases. There may only be just a handful of anesthesia folks, and you are it for that community. And so during the day you're it, at night when you're on call, on the weekends. And so it's important to have models that make sense, to give people adequate time off. And we have a mix of models. Some of them you get 13 weeks off a year, sometimes 17, sometimes it's just a 26-week model, because we want to make sure that people are able to engage in patient safety and that they keep that a priority and that they're fresh the next day when they have to come in to do those cases.
So Alex, how do you see the role of clinical autonomy evolving in the future of anesthesia practice, and how is CCI preparing to face these challenges?
Well, we're always looking for creative new models, creative new ways of meeting the needs of both the patients and the hospitals and the providers too, frankly. But there's cost pressures, there always is, and so there's always the pressure of doing more with less. Maybe you're someone who doesn't have a lot of experience with doing pain blocks. Okay, let's help you kind of expand your skill set in that regard. Maybe you don't have as much experience in OB as you wanted. Okay, let's work on mentoring you in that area and help you get more exposure to OB. And so the more versatile you become as a provider, the more it allows us to be creative in the way that we're solving the ever-changing landscape of clinical care and cost pressures and all that kind of stuff, to make sure that we find that right mix, that sweet spot. It's going to change. It's an evolving thing. It always does. The only constant is change, right? So We have to be forward thinking and saying, okay, what's over the horizon at this point? And that's where we rely on our medical affairs team to really be a key in that, because they're seeing what's out there. They're going to their conferences. They're doing continuing education. You're hearing what's the latest and greatest. And so one wonderful thing about CCI is we're very adaptable as a practice. If you come to me today and say there's a better way to do something, we're going to do it literally tomorrow. Like, we don't have to have a bunch of meetings about it, spend the next 6 months analyzing it. If there's a smarter, better way to do it, and we feel like it's proven and it can be successful, then we're going to jump right in there and do it right away. And it's going to benefit the providers, the clients, and our team as well on the business side.
Bronson, what future advancements or changes in anesthesia practice are you excited about, and how does clinical autonomy play a role in these developments?
So obviously a hot topic across many different professions is AI. I think AI will have some influence in anesthesia in really helping preoperatively kind of dig down and do a risk assessment. Patients just continue to get sicker and sicker, and we're doing cases at facilities that 20 years ago people say, you're crazy to do that case here. So I see AI evolving in anesthesia, and that obviously helps with clinical autonomy as a CRNA to be able to have that tool to add to the toolbox of something you can use in your practice. As well, for the first time ever, there are more CRNAs than there are anesthesiologists in the country. And so I see that evolving throughout the next years as we see a lot of people start to retire. How do we fill that gap? And obviously, I always joke and say CRNAs are the greatest kept secret. There's a lot of places that still are only physician practices. And so I'm excited to see us evolve as a company. And we're not so much in the rural areas anymore. We're starting to advance more into the suburban areas and maybe even into cities, and bringing the models that we use elsewhere into those practices.
How can interested clinicians learn more about CCI and the opportunities for practicing with clinical autonomy?
We have great opportunities listed on our website right now, and most any job boards that are out there too. We have phenomenal references, and when I say references, I mean other clinicians. These are folks that have worked with us for 15, 16, 17 years sometimes. I mean, we love folks that want to put roots down and stick with a practice long term if possible. Family things happen, things change, but go to our website, CCIAnesthesia.com, and you'll see wonderful opportunities all across the country.
That brings us to the end of today's discussion on the importance of clinical autonomy in anesthesia. A big thank you to both of our panelists, Alex Gorecki and Bronson Taylor, for sharing their insights and expertise with us today. It's clear that clinical autonomy not only elevates patient care, but also enhances professional satisfaction and growth. Unmasked is brought to you by CCI Anesthesia, leaders in anesthesia services for over 20 years. Subscribe to Unmasked, the CCI Anesthesia podcast, today so you never miss an episode. For more resources and information, visit the CCI Anesthesia website at ccianesthesia.com. We look forward to having you with us next time as we continue to unveil the remarkable stories and innovations shaping the future of anesthesia care. Until then, stay curious, stay informed, stay safe, and we'll see you next time.